Welcome to the Climate Tech Podcast. In this episode, we're going to talk about how climate change is affecting both physical and mental health, and why recognizing these impacts is essential for policy, planning, and support for affected communities. My name is Lasse Hemmingsen, and with me today are Liz Willetts, Planetary Health Advisor, as well as Policy Reporter at the International Institute for Sustainable Development, Alessandro Massazza, Senior Policy and Advocate Advisor at United for Global Mental Health, and Fatemeh Bakhtiari, Senior Advisor for Climate Policy on Loss and Damage at UNEP Copenhagen Climate Center. So thanks for joining me.
Thank you. Nice to be here.
Thanks for having us.
Thank you very much.
So there is a growing international focus on assessing and reporting on climate impacts, and this also goes for health, both mental and physical health. And it also brings this need for better indicators and reporting tools with it. So before we go into the details, maybe really briefly, Fatemeh, can you just tell us why it's important that we have this conversation now?
As you all know, in terms of the operationalizing of the fund for loss and damage, we have had we have heard that a lot of progress and a lot of things happened. Therefore, it's very important to have such a discussion now in order to make sure that the health aspect of the loss and damage is not left behind, especially not looking into the health from the economic aspect or from the physical aspect, but also looking into it from the non-economic aspect. So therefore, we're having such a conversation. We try to first of all draw attention to the health impact from the both angle of the physical and the mental, but also make it more obvious for the practitioner policymaker about the linkages and the importance of looking into the health and measuring health when it comes to defining priority for the loss and damage.
Mm-hmm. Yeah, because when we talk about climate change and especially loss and damage, of course, climate change affects humans, but it maybe with health and especially mental health, it's a little bit harder to see exactly what are the direct and indirect impacts. So maybe if we start with physical health and you, Liz, can you give us some examples of the kind of impacts we're talking about here when it comes to climate change and health?
We are people, we are in our environments. And so any change in our environments, whether they be atmospheric or in the natural system, are going to impact us on multiple scales and in multiple ways. And that can be across every physiological system of the body. What we're seeing now, as Fatemeh was just mentioning, we're trying to make sure that we don't lose track of that health impact and understanding what it is. And so what we have kind of more prominent data on, the kind of local environmental changes in the temperature, in heat, in weather patterns. We also have that, and heat can impact the body in various ways. It's a stressor across the cardiovascular system. It's a stressor for the dermatological system. It makes you sweat more. It can impact the kind of the experience of pregnant women and how they're kind of going through their pregnancy and the risks that their fetus faces. We also have a lot of data on how pathogens and microbes travel through systems and impact humans. So that could be through water. So vector-borne diseases through water, really common ones, the impacts of mosquitoes such as malaria and other infectious diseases. In my part of the world, we have a lot more vectors, ticks, bugs that can transmit diseases. We also have the impacts of infectious diseases in other ways, and that gets into complex relationships in ecosystems and the changing of species distribution, and problems with food safety. So that's where we have kind of pathogens or fungi that are now part of our food system. That is a great segue to me to actually lead to where we have some of the most prominent data and also kind of this most alarming predictions and projections for the future is on the food system. Just about every aspect of food consumption could be impacted because of the impact on the plants that we grow for food, as well as the animals that we care for food will face the same stressors that we are as humans in different ways. And I'll cut it short there, but we are really concerned worldwide about the impacts of malnutrition, and then also on water security and what it means to be able to have enough water, as well as water that's clean, and being in a ecosystem where our water cycle is stable. So floods and other things can not only impact the water that we drink, but the quality of that water. So we are really experiencing a lot of health impacts across a spectrum.
Yeah, that was a very wide list of impact you just had here, and seems to be affecting like the whole range of our lives. And I think it's also, I mean, to me at least, it was interesting also when we talked before this podcast that the main, like the big events we see, floodings, disasters, extreme weather events, like of course there are health impacts there, but the ones you're listing here are more, you see, they're less visible. They kind of I don't want to say sneak up on us, but they are more indirect and they're slow onset. They don't grab the headlines right away.
If I can jump in there with a kind of final point, thank you for bringing up that term. I think another way to summarize what's happening is we do have the emergent issues, and they're causing emergencies for physical and mental health. We also have as you mentioned, the slow onset climate change impacts, which are affecting humans in sometimes acute ways, but also in these chronic long-term ways. And we're really trying to understand that better. And I'm sure Fatemeh could walk us through the process to do that at the global scale. But we aren't as good at understanding the slow onset and the chronic and the cumulative as we are at looking at when a natural hazard occurs and taking care of the immediate problem. We're often in the reactionary mode. And just to offer one other insight of something that sneaks up on you, and UNICEF has done some interesting work on this, is looking at the impact of flooding on water quality on children. And something that's coming up quite a lot is when we have a natural hazard that impacts our crop fields that have chemical inputs on them. And the impact that bringing chemical inputs to new places, food, water, contact has on people. And that can be consumed, it can be tactile on skin, and it really is something that's quite alarming, especially in areas where we have those large agricultural lands.
Yeah, that was a whole new serious perspective. And then I think speaking of these impacts that aren't immediately visible, I think it's a good segue also to go to Alessandro and mental health, because that is even less visible, but not necessarily less serious. So from your perspective, what are the mental health perspectives on climate impacts? And also, is the same picture that Liz is painting of they're the big headline events, but there's a lot of stuff happening that isn't as visible and isn't as easy to identify and deal with right away.
Thanks, Lasse. And I think to build upon what Liz has just highlighted, I think a key thing to really stress is that mental health and physical health are, in a way, two different faces of the same coin. And all of the physical health impacts that Liz has highlighted will also have cascading impacts on mental health. So whether it's somebody losing a family member because of an infectious disease or somebody experiencing long-term food insecurity, all these are factors that inevitably will have ripple effects on the mental health of people that are being impacted. There are, however, also some impacts that are sort of more specific to mental health. So as you mentioned, obviously one of the main consequences of climate change that we're seeing is a rise in more extreme and frequent weather events, from floods to cyclones. And these can impact mental health in multiple ways. One is that they can impact mental health directly as people are exposed to distressing events such as death or serious injury. And that in turn can increase the risk of people developing new mental health conditions such as post-traumatic stress disorder, depression, substance use disorders. But also these events can really impact mental health by eroding what we call the social determinants of mental health. So what we need to be able to be mentally well and thrive in our lives. So having a job that is meaningful, having a safe house. And we can imagine how all of these events can really impact these factors and then in turn indirectly negatively impact our mental health. Liz also mentioned heat, and as Liz highlighted, heat impacts every organ of our body, and that includes our hearts, but it also includes, our brains and the way kind of our behavior and our cognition functions. And indeed, we are seeing an increasing amount of evidence highlighting the relationship between extreme heat and mental health. And on the one hand, it's something that I think we can all relate to. When it's very warm outside, we can, I think, all experience the impacts that heat can have on our mood. We might feel more nervous, more irritable. We might struggle to sleep. And all of these are things that can have impact on mental health. But also we're seeing how heat can have particularly detrimental impacts on people living with pre-existing mental health conditions, and how people living, for example, with psychosis can be at very high risk of mortality during episodes of extreme weather events. Another element that I think people will probably be quite familiar with when speaking about climate change and mental health is the emotional impacts that people experience when thinking or reflecting upon climate change. And we often hear terms such as climate anxiety, climate distress, ecological grief, and all of these largely refer to a number of psychological reactions that people might experience at the prospect of climate change. And people will experience a whole range of emotions, from anxiety to grief to helplessness to anger. And I think one thing to highlight is that in most cases, these are normal and rational reactions to the climate crisis, rather than mental health problems that require specialized mental health support. But having said that, people should obviously still be supported when it comes to navigating these reactions. So I think across the spectrum of mental health, from emotional well-being up to people living with severe mental health conditions, we see how climate change is impacting mental health on a variety of different levels.
Mm-hmm.
Can I pop in one thought to build on Ali there? Another way that we can think about the health impacts, as Ali was saying, is at the individual. How is the health impacting one person and their mental and emotional health and their physical health? But we're also seeing community-wide, population-wide scale health impacts. And many people are experiencing the same thing. That may be a skin condition. It may be asthma, breathing difficulties, or it may be a larger scale collective feeling of distress or anxiety. And so just wanted to point that out. When we, as health professionals, we think in terms of the individual when we're in a clinical environment, but we think in terms of the community and the population when we're in public health. So it's important to keep those in mind as well.
Yeah, there's a bigger perspective. And Fatemeh, you also wanted to come in.
Yes, what I want to also bring here, it's as a complementary focus, what we heard from Liz and Ali, that about the physical aspect, also about the mental aspect of the health related impact, is also looking into the health from the loss and damage aspect. So when at the center we have done stock take analysis looking into the country's reporting, the national adaptation reporting, health national adaptation report, health NAP, and also the NDCs to see that how health has been mainstreamed by countries in their national reporting. when we look at the loss and damage from the policy perspective, we understand from what we can read or what we learned from countries reporting that health really sits at the center of the story. Then we talk about the climate impact, as we heard detailed example by Liz and Ale. And what we used to think about loss and damage in economic term, and the same goes with what we read about the health impact as well. Like economic term, what I mean is like roads and house destroyed, or crops wiped out, or job and income lost. So then these national plans that we analyzed also describe very concrete health related loss, like more people getting sick or dying during heat wave, or they face different disease like malaria, dengue, cholera after floods, or hospital and health services or clinics that are damaged. So these are all the aspects that they have a very clear economic implications. That means, for example, lost working days or higher health care expenditures, and the long-term pressure on the health system. But at the same time, the stock take makes it very clear that the health is a core part of also the non-economic loss and damage. So countries talk about the human side of climate impact, the loss of life, and long-term well-being, the trauma of living through repeated storm and drought, and the anxiety and grief that comes with the displacement, the things that Ali very well mentioned, the impact that on people's sense of identity, belonging when they have to leave their homes or their lands, for example, or the places that with a deep cultural meaning due to the floods, and they get displaced. So none of that can be fully captured in monetary figures, but it is central on how communities experience the climate crisis, and also then whether they can truly recover. So from a policy angle, I would say health in the loss and damage act as like a bridge between the economic and non-economic dimension of the loss and damage. In one side, climate impact on health system, services, and health workforce, for example, are visible in the when it comes to the country budget, in productivity statistic, on the cost of the rebuilding facilities. And on the other side, the mental health burden, the loss of dignity and security, and the erosion of the, for example, the social and cultural ties reflect very much the non-economic harms that shapes people's lives for years.
Mm-hmm.
So what the stock take shows, or learning from countries reporting, is that if loss and damage frameworks focus only on one side of that bridge, that is, for example, the easily measured economic losses, so they miss a large part of what countries are already signaling in their policies, and they risk very much under-reporting and under-funding health-related loss and damage. So even though that is the heart of people's everyday experience of climate change. So if we are not going to, or we are not able to capture the non-economic angle of the health part, so the full picture of the impact is not there, and we are not able to really respond to that.
Yeah, that's really important, especially when you say at the end about responding to it, because if we can't measure and report on it, I guess we risk that the people who are affected are not getting the help they need, or the attention, or even the resilience building that could prevent it happening more in the future. So I think that would also be really interesting now to talk about who it is, the people that are most affected, with the most vulnerable groups to these climate-related health and mental health impacts that might not always be picked up and be easy to report, because it's, in terms of dollar value, basically, it could fall through the cracks. So which, and I know this is a hard question to put like specific groups to this, and who is it that we're talking about, but if we could have some examples of what kind of impacts are hitting which groups, and maybe some of the unequal exposure and unequal capacity to respond to this that we're seeing out there. Alessandro, do you want to go first this time?
So obviously the answer to who is most vulnerable will probably very much depend on the specific context in which you're trying to answer that question. But I would say that when thinking specifically from a mental health perspective about risk and vulnerability, as I mentioned before, definitely people living with pre-existing or severe mental health condition are one group that is often overlooked when it comes to protecting people from the impacts of climate change, despite being one of the group that is often the most impacted. So, for example, during the British Columbia heat dome episode in 2021, people living with schizophrenia were the single group with the highest level of mortality among people living with a number of different health conditions. And this probably is because people living with severe mental health problems often experience a number of intersecting vulnerabilities. So they might have high levels of comorbidity with physical health conditions such as cardiovascular diseases that also increase their risk when it comes to exposure to heat. They might have less access to adaptive resources such as appropriate housing, cooling system, due to the fact that this group often experience economic hardships. They might experience social isolation. So again, we see how there's many intersecting factors beyond sort of health specifically that increase their exposure and also that limit their ability to adapt. Also, often populations of people experiencing severe mental health conditions might also sort of overlap with other groups of people that can be particularly vulnerable, such as people experiencing homelessness, people residing in long-term institutions such as prisons or psychiatric institutions in some parts of the world where people often spend very long amounts of time in tertiary mental health spaces. So again, we see how there's many intersecting vulnerabilities and risk factors that come together in this specific group. Maybe a couple of other particular groups to highlight from a mental health perspective are children and young people as another key population. And this is also because of the sort of epidemiological timing when mental health problems tend to emerge, as we tend to see the majority of mental health conditions emerging before the age of 18. And that highlights how childhood and adolescent are really key windows, both of risk and opportunity when it comes to protecting and safeguarding the mental health of young people. So again, trying to ensure that climate impacts and hazards are sort of are impacting the young people the least. And I think finally, one thing that I wanted to mention from a mental health perspective again is people whose livelihood is particularly dependent on the environment. So farmers, agricultural workers, and that's again another group that where we tend to see consistently quite significant mental health impact. So, for example, in India, there's quite some good research showing that when we see droughts and episodes of water scarcity, in return, we tend to see heightened levels of suicide among farming communities as one of the impacts that climate change can have. Again, very likely mediated through economic hardship, impacts on livelihood, and then in turn impacting mental health.
Mm-hmm. Yeah, I mean, it's obviously some very serious impacts. And when we turn to health, then Liz, what would your answer be to which groups are we talking about here?
I think Ali did a really nice overview of impacts on typically vulnerable populations, and we know what those vulnerable populations are. He mentioned several of them. I would add women, pregnant women. Certainly, he mentioned children, the elderly, people who lack formal settlement, disabled, and any form of poverty. And what I would capture that all in is climate change exacerbates existing vulnerabilities. And so anyone who is vulnerable for other reasons in society or in the environment or in the economy, this will be a threat multiplier, as we call it. But I do want to highlight just one additional group, and with an anecdote. What we're seeing also is some of those who are most vulnerable are those who aren't aware, and those who have not received education or the mindfulness to think about what is happening in the local environment, the local ecosystem, and how that might change. And we had a particularly devastating story, not in my region, but near in my country, where we had a summer camp of children, a girls' summer camp, went out on the annual trip along a riverbed and set up camp for the night, completely unaware, and in a region where environment and climate change are not discussed. And overnight, a disastrous flood came by and wiped out the entire camp of children. And 20 something along the lines of 25 children died that night. And those families lost their little girls who were at camp because there was not the awareness and the thinking to go into this space of what are the potential impacts, what are the indicators we need to be thinking about, where the knowledge is coming in that we should be listening to, how do we protect ourselves. So if we're not reaching different communities with the education and understanding what's going to happen, not only the social impacts, the economic impact, the health impacts will be that much worse. And the kind, just to go over to Ali's area of expertise, the mental health, emotional health devastation of a tragedy like that is incomprehensible to lose an entire community. So how do we think about education as a tool to improve vulnerability? And how do we think about the terminology we're using?
Yeah, I think because one of the underlying premises for our conversation here is about if we want to improve vulnerabilities, like you say, improve resilience, and just get an idea of what is the problem we're dealing with, we need to be able to measure. We need to report it under these loss and damage frameworks that Fatemeh is talking about. It needs to be taken into account in the documents that you've looked at in the stock take. And just from my point of view, if we're talking about climate change exacerbating already existing vulnerabilities, how do you then measure how much worse it gets? Like, how do you measure? How do you report on? And how do you figure out where to start making things better if it's dealing with existing conditions or existing vulnerabilities? So maybe that leads to the importance of metrics and reporting, and then it gets a little technical and maybe not as concrete as floodings and summer camps, which unfortunately was very concrete. But maybe Fatemeh, do you have any good answers to that?
Yeah, I wanted to again go back to what we learned during this stock take, looking into how countries report on the health and mental health. And what I can bring here is that we saw that countries are starting to capture both aspects, but in different ways. For example, physical health has been described by most countries in most clear way. Many NAPs and indices list climate sensitive risk like malaria, dengue fever, cholera, heat-related illness, or different like injuries and deaths from floods and storm. So if you other NAPs and health SNAP go even further, not just as a descriptive way or as look like as a risk. So they, for example, when we look at Moldova NAPs, so they link heat-related deaths to national estimates of climate-related health costs. Or when we look at Lao PDR's health SNAP, we can see that they can set out like a concrete measures such as upgrading hospitals, some resilience measures, securing reliable water and power, and relocating facilities away from the high risk area. So they come up with some response, not only defining the indicator. So from the health, mental health and other non-economic loss, how they measure it or how they define it, so the gap is much bigger. So countries describe it describe very real impact in a way. They talk about long-term anxiety, trauma after repeated disaster, communities effect and damage because of the displacement, but these are rarely turned into the proper measurable indicator. These are stays still at a descriptive level. Some national plans only mention the scale of the problem, and for instance, by noting that these are only one or two. For example, in one of the NAPs talking about the scarcity of psychiatrists in the entire country to respond to the mental health issue coming from the climate change, or by mentioning that the psychological support programs exist, but without defining really a clear target or timeline to it. So it's still in a very general way. So countries are beginning to talk about, to tell their story, but there is still no simple that widely used way to track the non-economic aspect, non-economic health and mental health loss. So and that is not only about the health, when it's about non-economic loss and damage in general. That because we don't, it's difficult to quantify and put monetary value on, so it's different, and still the methodologies is under development to capture and define proper indicator. So that's why better indicator and reporting tools are so important, so this impact don't stay invisible because they are hard to count.
Mm-hmm. It sounds to me like this gap you're mentioning. Well, okay, so countries are starting to be aware of this. They're telling the stories, but if it's non-quantifiable, if it can't be put into reporting formats that go into these international mechanisms, there's a missing link between being aware and then action, and maybe getting funding to do the action that you need to do. Is that correctly understood?
Yes, but also what I want to say here is also it's maybe we need to change the expectation of not everything should communicate, should be able to quantify it or report it in a monetary term. When it, yes, historically policymakers and decision makers, it's easy for them to look into the number,
Mm-hmm.
but maybe we should broaden our perspective when it comes to values, when it comes to the non-economic losses, that there are other complementary measures should be looking into and bringing to the picture in order to provide us the best tool in order to capture them.
Yeah, and then building on that, let's go back to Liz and Alessandro on then. Okay, why is it so important? What is it that we gain instead of looking at the vulnerable groups and the impacts? Let's put on the positive spin now. What do we gain from better recognition of health and mental health and non-economic loss and damage, and instead of looking at dollar value, what do we gain as societies as countries if we start with this recognizing health and mental health and climate policy and resilience planning? Liz, do you want to go first?
Another tricky question, but because the global environmental changes are impacting us to such a great extent, climate change is having such a great extent, we are having to rapidly, urgently, and broadly revisit our relationship with the environment and nature and the natural world and planetary systems in a way that we haven't in the last decades. We don't have to just think about you know the economic sense of what those impacts are doing. We have to think about it in terms of the health impacts in order to safeguard our futures and what our livelihoods will look like and what our living situations will look like. And I wanted to jump off my story on summer camp and tie in Fatemeh's story about trying to understand these different indicators by saying one area that we need to look into and that we are looking into, especially related to loss and damage, is values. And so we need to understand climate change in terms of different values around the world. We have different concepts of health. We also have different concepts of ecosystem. And where that brings us with non-economic loss and damage is looking at values in a much more comprehensive way, thinking about market values, thinking about non-market values, which are all economic, and then going over to the other side, which is non-economic, looking at intrinsic values and looking at relational values of people and place. There is a whole body of work looking at diverse values, especially under the environmental governance regimes. This is separate from the UN Framework Convention on Climate Change, but it is how we are approaching ecosystems, not only to look at threats and risks and understand threats and risks, but to find solutions that work for local places. And when we take the summer camp example, in my country, there is severe political division on different terms related to the environment, including climate change. In a community who values their children, doesn't want a flood to wipe away a community of girls, but doesn't use the same terms as, climate change or another community, we need to find ways to think about the values of different people and their communities in order to find the right indicators and to develop meaningful policy and measurement. So this can be within my country, which is a global north country. It could be any country. It could be Lao PDR. And how are we going to do that? How do we look at those costs to non-economic, intrinsic, and relational values when they're notoriously known as hidden costs? They are not part of our economic system. They are external values. And not only recognizing them, but finding indicators for them and indicators that make sense for people at scale. So do we go national? Do we go regional? Do we go global? Can we actually find indicators and metrics that are going to work? And how is that going to help us improve policy, not only at the national or local level, but also in regimes like the UN Framework Convention on Climate Change, where we're trying to push all countries to get better at this. And I just wanted to emphasize also that different communities have different communities have different values of health. So not just thinking about health in terms of the way I think about it, or another person thinks about it, kind of thinking about health more broadly, because that's where we're really going to see elements of change that impact your mental health and your emotional health, your community health. And we're at the starting point of that. And I think some of the research I've done looking at the national adaptation plans in the Asia Pacific and also at kind of globally looking at assessments, we are a bit disorganized about how we're doing that. And we haven't sharpened the field enough. We need more investment to think about the field in a cohesive way and in a sharp way and an equitable way, and to be able to put that into terminology so that we can find the right metrics that are going to work. Over to Ali.
If I can jump in just before, I'm gonna try to just sum it up, which might be a bit difficult, at least for me. But one of the things I'm hearing is also if we start with people-centered approach, we look at how people are affected, and like you said, with there might be a political divide, but if we look at how do we protect our children or ourselves or our communities, then the action that builds on that is going to be more effective, but it's also going to be less divisive. It's going to be things that we can all see benefits us or our children. And I don't know if this like people-centered approach to both measuring and also to climate action in general, I'm hoping that would also be something that kind of speaks to the mental health part and what you want to say, Alessandro.
Yeah, maybe I also just wanted to get back to a point that Fatemeh brought up about I think the complexities of measuring the mental health impacts. And I think that's definitely been the case in the past and currently about the sort of difficulties in quantifying the mental health impacts of climate change. And that is indeed reflected, I think, in policy. So when looking at the NDCs, according to the WHO, only 3% of NDCs include references to mental health, and that's a really small number compared, for example, to 28% of NDCs covering vector-borne diseases. And that's very much the case whether you're looking at NDCs, whether you're looking at NAPs, whether you're looking at heat health action plans. Mental health often is one of the least included health outcomes in climate policies. And I think there is a number of reasons for that. One is that mental health is often quite conceptually complex. I think, as this discussion has shown, when we speak about mental health, we really speak about everything from place identity to schizophrenia to suicide. And there's a whole range of outcomes which makes it quite challenging to identify the mental health indicator when looking at the impacts of climate change. There's also a huge issue of data availability generally. So I think, again, there are very real reasons why it has been challenging to measure the mental health impacts of climate change. But having said that, I also think that we are moving in a direction where we're increasingly being able to quantify and give specific numbers to these mental health impacts. So again, to give you a concrete example, it has been estimated that by 2050, the additional cost of mental disorders due to climate change will reach approximately $245 billion US, which is equivalent to what the UK spends every year on its national health system. Similarly, we're seeing a huge amount of increase in research trying to quantify the impacts of climate change and mental health. And according to the Lancet Countdown on Climate and Health, research on the mental health impacts is one of the fastest emerging areas of research when it comes to health impacts. Similarly, in the context of UNFCCC processes, out of the 59 indicators within the global goal on adaptation, one of them is an indicator that is looking at the proportion of populations vulnerable to climate change that have access to mental health and psychosocial support. So I think we're seeing, despite the methodological complexities, progress when it comes to measuring the impacts of mental health. But maybe I responded to your answer around the value of considering mental health when it comes to loss and damage. I think one point is the value of sort of considering mental health when it comes to climate change more generally. And I think there has been mentioned already, but one interesting perspective is that I think the health impacts of climate change really allow people to understand how an abstract and really complex construct such as climate change is impacting their personal life, the life of their loved ones. And hopefully that can also encourage people to take action. And just last week, a report from the Wellcome Trust showed that when you frame climate change from a health perspective, people are twice as likely to shift their attitudes towards climate change and become more likely to be supportive of climate policies. And mental health was actually one of the framing that was most successful in making people more concerned about climate change, but also making them more willing to engage with issues related to climate. And I guess from a loss and damage perspective specifically, I think it's really important to highlight how mental health is not only an outcome of loss and damage, but it really shapes also a community's ability to recover. So we need to consider mental health in loss and damage discussions, because it's not only about the impacts that we've spoken about, but it's also because if we think about somebody that develops depression following the loss of their house after a flood, we know that that will impact their ability to work, their ability to contribute to reconstruction efforts, and therefore it will impact recovery efforts overall. And ultimately, this means that investing in mental health is also investing in a community's ability to recover and be resilient in the long term from the impacts of climate.
Mm-hmm. That's a really good point. We are getting close to having talked for about an hour now, which also means that I would be moving towards like the final question. But before that, is there anything else either of you want to jump in with before we get to that point?
I think an important part of framing continues to come up when we try to structure indicators. And there is a bit of a disconnect when we try to bring social, economic, and environmental sectors together. And I just wanted to highlight this as a health professional myself. When I look at that very long list of indicators that Ali mentioned, the 59 indicators, also on the global goal on adaptation, which has 7 indicators or targets, and try to look at those as a collection, what I find are specific lines related to health. The word health is in it, health systems, mortality, different health, public health terms that are very concretely related to health and well-being. Sometimes we have an issue in zooming in on that as if that is the entire health picture. But as Ali and I and Fatemeh have been discussing, health and well-being is quite bigger than that. And so when we look at the indicators, no matter what discipline or domain you come from as a professional, it's important to think about the other indicators that are also health related. So the indicators in the global goal on adaptation, there's 7 of them, are actually all health related. The food system, ecosystems, the settlements and infrastructure, cultural heritage. These are all part of the picture and the impacts that Ali and Fatemeh and I have been discussing. But when we do indicators, sometimes we separate them and we have different people doing different indicator jobs. And that is to our detriment. And the more we can see those measurement tools as part of the same collection and package towards improving our response, the better. And again, part of the reason we are in that situation of separating indicators is because we have different domains and fields coming together. In the health field, I would not separate nutrition from health. In the development field, I separate food from health. So when we make indicators, we have to be aware we are coming from these different domains and disciplines and work, kind of invest and coordinate to be more cohesive. So that we are doing better and our policies are better and our monitoring for health impacts is more practical and also more realistic.
And maybe just to add on what Liz is saying, I think the fact that health is so connected to all of these other sectors is ultimately, I think, great news for health, because it means that we can also impact health by changing all these other systems that we would need to change anyway in order to engage in ambitious climate action. So if we think about green spaces and urban spaces, changing these can have huge co-benefits for physical health, mental health, active modes of transport, sustainable housing, nutrition. The fact that the indicators are connected is also a sign that the responses and the solutions are interconnected as well, and that we can impact health by addressing upstream determinants as well, and achieve ultimately win-win solutions both for our health and the climate.
Mm-hmm. And making climate action, linking it with human well-being, with us. Like when it comes down to it, climate action is about the humans that climate change is impacting. So it is all connected. Fatemeh, any final comments?
Yes, thank you. So I just wanted to provide a little bit about looking ahead in terms of the policy and practice when it comes to the health and loss and damage. From again, what we have been reading from the stocktake analysis. So the message from what we have learned is clear. So health is now widely recognized as a key part of the climate-related loss and damage, as we heard also from Liz and Ali. But that recognition hasn't yet turned into the consistent practical action, at least in the country reporting. I'm talking about from the perspective of NAPs and health SNAP and NDCs. So countries describe the risk in very detailed form but but those risks they don't always show up in a concrete plans, budget, and governance arrangement. And again, this also links into proper tools and measure and indicator, because the still is not there, is getting there little by little. So therefore, there are a couple of points that I would like to highlight as like a priority to close such a gap, at least for the country, from the country perspective when they write their national reporting. So the first thing is would be that to make sure the health is clearly spelled out across all the main national climate instruments in their disease NAPs, health SNAP, and also is reflected under the loss and damage section, that countries that have started describing loss and damage as like either is like a standalone section, or still some countries they put it under the adaptation, but make sure that health is there under the loss and damage dimension. So therefore, it helps when we talk about linkages for means of finance support in the future, and defining the proper response measure. The other point is to bring the mental health and other non-economic losses into the center of the agenda, not at the margin. Ali described it very well, that mental health is one of the key and a strong measure in order to really respond in general when it comes to the climate change and particularly for the loss and damage. So that's a very good news, and we have to really follow on that. Liz clearly mentioned it. Health is everywhere, so we need to very much to highlight that in our agenda, and also to move beyond just listing vulnerable groups. And as we heard from Ali and also the Liz, we know that vulnerable group, they get affected differently. So we need to make sure the response measure is very much defined based on which group we are talking about. And also be very much clear about the implementation plan. Who is responsible? What sources are available? What timeline, and how progress will be tracked, and while also making it easier for countries to access international finance for health-related loss and damage. When we are clear about our target, our timeline, our indicator, so it's easier to justify when it comes to attracting the finance for people. And that's the ultimate goal, to be able to provide and direct more finance to countries to really looking into the health aspect of the loss and damage. That's a real opportunity for the loss and damage regime to put health, including the non-economic life dimension of the health, at the heart of the climate action when it comes to the loss and damage policies. Thank you.
Thank you. And you touched upon a lot of the things that luckily you all three have been agreeing on and talked about. So I'm gonna give also Alessandro and Liz a chance for their comments towards the end here on moving from, like you say, Fatemeh, from recognition to implementation, and not necessarily how we're going to do that, because that's very complicated. But what do you think we should prioritize in terms of making health and mental health key and also central, so we have this people-centered, human-centered focus when we talk climate action?
Could I go second?
Yeah, absolutely. I can try, and I can maybe even risk trying to highlight some hows to move from recognition to impacts, because I think 2 points I wanted to highlight when it comes to moving beyond recognition to implementation, specifically around mental health, is one, like we mentioned before, I think we don't necessarily have to reinvent the wheel when thinking about how to protect mental health from the impacts of climate change. And one is because, as we said, ultimately, many of the things that we would need to do anyway when it comes to ambitious climate action will have really significant positive impacts on our health. And whether that's mitigation activities such as active modes of transport and green spaces, or adaptation activities such as better disaster preparedness, these will have really positive impacts for our mental health. And the second reason why I don't think we need to reinvent the wheel, and there is many concrete examples of things that countries could do, is because we have a huge amount of expertise and data when it comes to responding to mental health and psychosocial needs, for example, in humanitarian settings. And we know that there are interventions that work, that are evidence-based, that are cost-effective, from community-based mental health services to talking therapy, such as cognitive behavioral therapy. And we also know how mental health and psychosocial services are now widely recognized as a core component of emergency response in humanitarian settings. So there is a precedent. So I think both of these elements give us hope, hopefully, to really try and ensure that when climate change impacts happen, we don't only think about reconstructing houses and addressing physical infrastructure, but we also try and ensure that we're rebuilding people's health and well-being, as well as their houses and the physical infrastructure.
Yes, that also goes for building resilience. When we're building resilience for houses and infrastructure, if we focus on mental health, we're also better prepared and less vulnerable if and when we are hit with climate extremes. All right, Liz, are you ready?
Yes, thanks. Well, I have just a few quick points. Kind of moving towards action. Where do we go from here? I think my key points would start with, first, we are identifying climate change impacts by what is happening locally around us in our ecological environments. So really kind of taking away that human health is deeply related to and dependent on our natural systems, our local ecosystems, and the global environmental changes, climate changes that are influencing those local systems. We have a dependency there. And that is going to be something that helps us understand impacts, but also helps us understand solutions. That being said, I recently did a large project looking at 49 countries of the Asia Pacific and how we're thinking about climate planning, so climate ambition, looking at nationally determined contributions. And what I found is we need to get much more granular about what we're talking about. So in looking at 49 different countries, we found, yes, almost 75% of them are talking about food security, but only 25% of them are talking about food safety or the impacts of toxins and microbes in the food system. 85% are talking about human health, but only 6% are talking about micronutrients that impact our health stability, the stunting and wasting of children, or the iron levels, the anemia trends in women. So we need to get much more granular. And though we're touching on these big health-related topics in our climate plans, we need to be much more specific and detailed. What does that really mean? And how do we use the expertise, and as Ale said, a massive amount of data and evidence to be better at measuring, monitoring, creating indicators that really work and give us a better picture. The third piece is like loss and damage. When we think about loss and damage, just understanding that with the lens of local values. So local health values, what does health mean to someone in the Pacific versus what does health mean to someone in South Africa? Those are very different things. And what are the health systems that correspond to those differences in health values? Also, environmental values. The development of our understanding of different ecological changes is going to be based on different environmental value systems. So thinking about loss and damage and starting to parcel that out in terms of the diversity of values we have in the planet will be really helpful. And then in terms of non-economic loss and damage, we again need to get more granular. We need to think about two key things when we're thinking about non-economic loss and damage. When we think about physical health, we need to think more about the slow onset conditions that we haven't yet explored, or the complexity of interacting concurrent physical health conditions. You can have an infectious disease at the same time as you have asthma. You could be hit by multiple floods at the same time with different health impacts. There are also the cumulative impacts and the chronic conditions that we see 5-10 years down the road that we need to be thinking about, not just as individuals, but as community health systems. How do we plan for that? And the intersection. We need to get better at the intersection of physical and mental health, not only, as Ale was saying, for dealing with the impacts, but also for resilience and creating communities that are able to continue on and make solutions and good decisions. And then lastly, my last point is about how do we make these metrics, going forward, really have to think about synergies. We can't just do this under one policy domain. It can't be under one framework of climate decision-making, environmental decision-making. We talked about the diversity of indicators. We talked about the diversity of problems. Those are being managed under different systems. And it doesn't matter if you're in local government, national government, or in a global intergovernmental body. We traditionally deal with individual problems in separate ways, but we have an enormous strength if we start to think more synergistically across these spaces. And I know UNEP does that quite a bit. But even in national plans, a country has several national plans that might be related to climate change, might be related to the built environment, to environmental management. We can think about metrics across those much more effectively, and the way that we make decisions from them. So synergies would be my final point.
Yeah, really good points from you and from Fatemeh and Alessandro as well. There's a lot to be done still, but I think it was, first of all, this was a very interesting conversation. I mean, it's from my point, coming sort of from the outside, it's nice to hear that there's a growing recognition of these impacts and how important they are. But the numbers that you gave, Liz, with like the difference in how many are talking about this, how many are actually talking about the specific things, like the things you actually have to do to address health as an overall topic, or mental health. There's this disconnect between recognizing it from the stock take. Most countries recognize mental health, it's important. But then the actual implementation and the plans and getting down to the people-centered level where we are actually dealing with the impacts that people are facing or will face in the future. So lots of work still to be done. Thank you all three of you for joining. It was very interesting, and I really appreciate it.
Thank you.
Absolutely.
Thanks for having us.
And thanks also to our listeners. If you want to access the stock take that Fatemeh mentioned, Loss and Damage Beyond Economics, Exploring Health as a Non-Economic Loss in National Climate Planning, or any of the other resources mentioned in the podcast, you can find all the links in the show notes.